maintenance therapy is a very important component of how we treat patients today in colon cancer. And the reason is we start understanding more and more how that links to quality of life and how it ends up not compromising outcome. And two important things. Anytime we think about treatment, we think, and the patient asks you the question, how long am I going to be on this? Since we're talking about patients now surviving, at least the right patient with the right treatment surviving beyond 3-4 years, so there's a good chance, they're going to have a good life, limited by the cancer, but a good life. And we have to optimize our treatments in a way to maximize the quality of life of our patients. So importantly comes the concept of maintenance therapy. So in many ways, we look at the combination chemotherapy, whether doublet or triplet. Majority of patients will go on doublets for 3 to 4 months. And we optimize their response and their initial outcome with a doublet. And usually after 4 months, you get this plateau. There's no further benefit from aggressive induction therapy. And this is where we consider maintenance therapies. And we have proof of concept. We have a phase 3 study, which essentially looked at patients after 3 to 4 months of Capox plus bevacizumab, going on capecitabine plus bevacizumab, low dose, continuous, versus observation or chemo holiday. The patients who went on the maintenance had an improvement in their progression-free survival in 2 instances, and then there was a trend towards improving their survival. So we know that essentially those patients tend to maintain the benefits of chemotherapy by going to a less aggressive maintenance therapy. We also know the cumulative knowledge of the previous years, from a multitude of studies, Optimox, there were some studies with FOLFIRI on and off. They all suggest the same, that we can give our patients a break with maintenance. In fact, I'd go further. There are some patients in my clinic and in oncologist clinics that come and say, I've had a great response, I feel good, I don't want to do any further therapy at this point of time. And I think on a case-by-case basis, usually those are the patients who have fantastic responses or essentially who have a hard time with continuing even with low-dose chemo. For those patients, I think chemo holiday makes sense. But the majority of the patients should have maintenance therapy if possible.